This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
All right, so our program, it's been around for a while. First class graduated in 1986. We are 3 residents per class, and it's an advanced program, so just PGY 2, 3, and 4. We kind of see the gamut of rehab diagnoses in our clinics and in our rehab hospital. And one of our faculty is involved with the Toledo Pain Management Fellowship. We also have a Coughlin Trust for funding of certain things, which is basically a person donated a lot of money and we get to be the beneficiaries of that. So the leadership, this is actually all of our attendings is a smaller program. Dr. Farrell's on the right. He's the program director. Dr. Suico, second from the left, Dr. Schneider all the way on the left, and then Dr. Wisher in the middle there on the right. Great attendings. You know, it's a smaller program, so we get to work closely and know them well, grow and build great relationships. They're all great mentors. I think the other PGY4s here on the call with me would say the same thing. So here's our program. You know, we hail from mostly the Midwest. The 3 of us PGY4s happen to go to UT, but otherwise there's only one other PGY3 that did as well, and otherwise we're coming from other medical schools. Recent graduates, you can see the list of things we're doing after graduation. Some of that includes fellowship, some straight into practice, inpatient, outpatient, kind of running the mix there. Also, I'll say Dr. Brady there in the bottom left just finished pain management at UT, and Dr. Schwartz there in the left just finished his sports fellowship at University of Toledo also. So those are some in-house fellowship opportunities that are available for residents. All right, so some benefits, pretty good benefits. We get to go to books, or so let's see, we get $500 in books or for an elective conference. I know some of the residents have gone to some regenerative medicine conferences as their elective conference. The AANEM conference, kind of up to you what you want to do there. You don't have to either. And then we get money every year for annual meetings, for attendance. And then, let's see, so you go to AAP, your PGY 3-year, AAPM&R, your PGY 4-year. And also some various review courses. Other benefits, so you get 20 days of vacation time, which basically equates to 4 weeks, plenty of sick leave, 10 holidays per year. It's a state institution, so it's pretty nice, state of Ohio. So we get all the public holidays off. So as far as our didactics go, it's protected time for us. We have monthly or near monthly therapy and services where the various therapists will come and talk to us about a specific topic, and usually those are really helpful. We have a formal lecture series, didactics on Wednesday, which includes grand rounds, journal club, guest lectures, and then otherwise various topics in PM&R. We have review questions once a week, usually with Dr. Farrell. Those were very fun this year. Actually, it was a trivia format. We also have our MSK series, one of my personal favorites. This is every Thursday for an hour. So we have like a, let's see, a 6-month cycle, 3 to 4 week blocks. So we do anatomy, pathology, then do ultrasound based anatomy. And then for the fourth block, we'll do intervention, either with ultrasound or fluoroscopy in the cadaver lab. It's really helpful, and we can kind of do things that we don't see as much, or just get extra practice on what you need. It's a really helpful part of the curriculum for me, at least. Breakdown of rotations. So at our program, we have a 12-month inpatient requirement. So that'll vary from program to program. Something to probably note. Some programs will be much higher than that. No one will be less. That's the ACGME minimum. And so our schedule is inpatient heavy PGY 2-year, and then just progressively gets less inpatient heavy after that. We start doing more of our electives and outside rotations. So you can kind of get a feel for the schedule here. I think the schedule is pretty nice. But you can kind of make of it what you want. We do have a couple elective months, so you can get extra exposure in what you're looking for there. As far as our sites go, we do inpatient coverage at the Rehabilitation Hospital of Northwest Ohio. It's on the University of Toledo medical campus. We typically will walk from the main hospital to the rehab hospital. It's like a 1-minute drive if you drive. Our outpatient clinic is at the University of Toledo Medical Center main building. We very rarely will go to ProMedica Toledo Hospital for inpatient consults. We are also there for various rotations, neurology being the one I can think of off the top of my head. We also rotate at the Toledo VA. It's mostly an interventional clinic, and it's a lot of good learning, a lot of ultrasound guided injections with Dr. Suico. And we also go to Regency Medical Campus, which is a satellite branch of the University of Toledo system in Sylvania. It's a 10-minute drive north of the main hospital campus. So these are some pictures from the Rehab Hospital of Northwest Ohio. It's a freestanding hospital, really great place to work. I think it's a 40-bed max hospital, but typically we're around 30, I would say, which split between the 3 residents is very manageable. Really nice inside. I think it was built in like 2015 or 2016, so it's still pretty much brand new. Really a great place to work. So a little bit about Toledo. It's called the Glass City, situated on the banks of the Maumee River and on the shores of Lake Erie in Northwest Ohio. You can see it right there on the map. It is one of the 4 largest metropolitan areas in Ohio. We have a symphony, basically all the things you could want in a mid-sized city. It used to be called the Glass City, or it still is called the Glass City. We used to make a lot of glass here. Typical Midwest city with all 4 seasons. You get the leaves changing colors in the fall, a little snow in the winter, hot summer. So top 3 things we love about Toledo. The zoo is great zoo. Christmas lights are fun there. They have concerts. They have an orchid sale, which I went to this year. It's pretty nice. Really nice art museum if you're into that sort of thing. And then the metro parks, which is my personal favorite. Really, actually, I think they invest a lot in the park system. They're very pretty, a lot to do. There's a ton of them. They're very well kept. A lot of nice little trails to go on for when you have time. And that's all I got. Going to open it up to questions. You can email us too if you want to ask your question via email or on Twitter or Instagram.
Awesome. Thank you. You got about 10 minutes for questions. Fantastic.
Okay. Let's see here.
So anybody on the call, if you have any questions, just drop them right in the chat. It's usually the best way to get your question answered.
Oh, someone's sick. So typically it's an issue if someone's sick at the rehab hospital, someone will cover for them. It's typically, I mean, there's 9 of us total. So if one person is sick, we just pull the resident from clinic and they'll cover the rehab hospital. If they're on clinic and they're sick, the attendings can function without the residents. So they just go ahead and function without the resident. Call schedule. So the call schedule is really nice. So when you're covering the inpatient rehab hospital, you're on call once a week while you're there. And that way, you know the patients and it's very manageable. It's also home call. So you take all your call from home. And then I actually don't know what it is if you're not there. I feel like I'm on call because I haven't been there since my PGY2 year consistently. Say like a couple of times a month, maybe like twice a month, if that, maybe once a month. But yeah, when you're there, it's once a week. And otherwise we split the weekends almost evenly. So you're on call. It almost comes out to once every 9th weekend. You do like 5 to 7 weekends a year, something like that. So it's really manageable. And then if Dr. Hutcherson or Goatley want to jump in here at all, feel free. Any formal mentorship? Not to my knowledge. I mean, I know all the attendings, like I would say they're all my mentors. I don't think there's anything formal, just because there's only 4 of them. So I think I would say they all mentor us pretty well. The vibe between the residents and the other multidisciplinary team members. It's a good vibe. It's a good vibe. So at the hospital, we know it's a small hospital, so we know the therapists, we know the nursing staff. We joke around with them. It's a good vibe. In the clinic, the clinic staff. So I would say it's a good vibe, especially, and then between the residents ourselves, it's also a good vibe. So it's a lot different than working in a big hospital system and like not knowing anyone. To me, it's a lot nicer. But it's something to get used to if you're, like I know all the nurses by their first name, all the therapists by their first name, we talk to each other. It's not like you see someone once and then you never see them again, the whole year. So what do you like about your program and what would you like to change about it? So I think I like that. I think I'm like well prepared as a physiatrist. I think we get a lot of good exposure in various different things. I haven't done my pain medicine rotations yet, but I would like to do more fluoroscopic guided injections. But I probably will do that this year. So we'll see about that. If either of you want to jump in here.
Yeah. I'll spell you here, Jordan.
Okay.
So we got from Kate. You are doing all of the medical management of patients when at the inpatient rehab facility. So we are the primary team on all of the patients at inpatient, and we don't have internal medicine in our facility, but we do have pulmonology, nephrology, cardiology. They're pretty much daily. We have really good relationships with them. Whenever we have somebody coming in that we'd like their help, we can just send them a text and let them know what we got for them. Urology's there as well. Anybody else? If we have, if we need like IR, we had a patient, we just call over to UT, which, like Jordan said, is a minute drive, and we can usually set them up with an appointment pretty quickly, whether they need a CT scan or an MRI. Usually day of, we can get them over and back pretty quickly. Are there certain fellowships that many of your residents match to? I'd say sports and pain are the two big ones. Those are the two that we have at Toledo that we rotate with directly. Otherwise, we've had people go into brain injury recently. I think we had one go into peds within the last 4 or 5 years. Really, we get exposure to everything that we'd want, inpatient and outpatient. And if there's a specific interest that we have, our attendees are very supportive of that. Whether it is peds or some of the stuff that we don't get a lot of exposure to, they're open to working with us on that. Brain and spinal injuries, do we get exposure to that? Absolutely. And we have an open unit. So there's no specific floors or units that are all spinal cord or all brain injury. There's just a good mix on every team between our neuro rehab stuff and orthopedic stuff as well. Co-residents that have couples matched. I can't say that we have to my knowledge, but UT does have a lot of other residencies in different specialties, so I definitely wouldn't rule that out as a possibility. I think it's just kind of luck of the draw. And electives in different programs for fellowship during PGY 3 and 4 year. It's not something that we've done recently. I think if you had a strong desire to do that, then we'd be able to work with our coordinator and our program director, Dr. Farrell, in making that happen. But that's just, I think all of us feel like we get a pretty good exposure from what we see, and just haven't had an interest in that.
And just to add to that, if I recall, I believe Jordan did his PGY3 elective in headache medicine through the neurology department because he was interested in that, and they just managed to arrange it.
Weekends, no.
So
Call days are, so you're on call when you're at home. You do home call on a weekday, and that's once a week when you're at the on the inpatient floor. And then for 6 ballpark weekends a year, you go in each day on the weekend, you round in your team, you admit your patients, and then you go home and take call for the rest of the day. So typically we're out by 12, usually at the latest. And then you take home call. It's not like a regular day at the rehab hospital.
Awesome. We got 2 more minutes.
So a typical day, you get there at 7:30. You either pre-round or round with the attending. You do your rounds however long they take. You admit your patients. You can eat lunch and breakfast on the house there, which is nice. And then we're leaving by 5 on a daily basis.
And just the structure to set up, it's each team is 1 resident, 1 attending. You're in charge of the patients on your team. Typically doesn't exceed 9 or 10. It's very manageable. Yeah.
Number of admits never goes above 3 on one day. You might have a few in a few days, but never more than 3 at once.
Yes, it's a mix of everything. So you just kind of get what you get. And so you'll have a hodgepodge of brain injury, spinal cord injury, stroke, some various debility patients. So every day you get a little bit of everything.
Awesome. And we're right at time. Thank you so much to the three. That was an excellent presentation and some excellent questions from our applicants.